Eleanor's career spans international settings where she has worked with diverse populations, including seniors, families, couples, individual adults, and youth. She specializes in clinical mental health support using client-centered and strength-based approach to empower clients and enhance their well-being. She provides services in both English and Hebrew. Maria Valle Perez is a social worker care navigator at Circle of Care with over 10 years of experience providing client centered care to clients and family caregivers. Her experience includes case management, crisis intervention, counseling, and group work. Maria works with clients experiencing complex medical issues and psychosocial challenges, assisting them with system navigation and linkage to community support services. Maria uses a diverse approach of therapeutic modalities with clients to help maximize their full potential. Maria provides services in both English and Spanish. Today's session will be recorded, and the recording, along with resources and a follow-up survey, will be shared via email. Please type any questions you have in the Q&A. Eleanor and Maria will address them during the Q&A at the end of the presentation. And with that, I will turn things over to our presenters.
Okay, well, thank you so much, Hani, for your introduction, and thank you very much for inviting us to speak today. Maria and I are really excited to be here, and Circle of Care is really proud in partnering with so many wonderful organizations to support our community. So, as some of you may know, at Circle of Care, we work mainly with older adults and their families. And so, very often, caregivers are an integral part of the relationship and the care plan. We also work with caregivers individually as well. So, over the years and through many, many conversations with caregivers, we've learned just how important supporting them is. Often caregivers become so invisible or secondary to the point that their own feelings, challenges, and individuality get overlooked. This could be by others, such as family members or even professionals who really focus on the ones that they're caring for. But often it also is they overlook or just completely their own needs become secondary as well. So talking about this topic is really something that both Maria and I are very passionate about. So we really thank you all for taking this time to join us for this conversation. Okay. So this is just our agenda for today. So we're going to talk about caregivers, obviously. And like I indicated, they are such an essential but often unrecognized group. And they play a vital role in supporting their loved ones. Their work touches every corner of our healthcare system and profoundly impacts the lives of millions of Canadians. Today, we will look at who caregivers are, their role. We'll share some statistics with you. We'll then discuss some of the challenges that they face. We'll talk about what resilience is and why it is so important, and why recognizing and supporting caregivers is more important than ever in today's aging and increasingly complex society. So before I begin, I did want to go over this very famous quote said by Rosalind Carter. So as you know, Rosalind Carter was the wife of US President Jimmy Carter. And other than being the first lady, she was an activist. She was a mental health and caregiving advocate since the 1980s. This was an absolute passion of hers, and she was one of the first prominent public figures to focus on and to highlight the needs of family caregivers. She's done a lot of work on this. So she said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Her message really was that caregiving is such a universal experience and it impacts or touches essentially everyone at some stage in their life at one capacity or another. Unfortunately, eventually she herself became on the receiving side of caregiving when she was diagnosed with dementia in 2023, and she died later that year at the age of 96. Okay, so who are caregivers? So, caregivers are individuals, often family members, friends, sometimes neighbors, many of which do not actually consider themselves caregivers, but they really feel that they're just doing what they're supposed to be doing. They provide unpaid support to someone experiencing frailty, undergoing palliative care, recovering from surgery, injury, someone living with chronic illness, degenerative condition, physical or mental disability, as well as age-related disorders. There are many terms for caregivers. You could hear family caregiver, carer, care partner. All of them are commonly used to refer individuals who provide care. The terminology may vary, but they all describe someone offering unpaid support to loved ones. Okay, so who are they caring for? The slide represents a breakdown of caregiving relationships, and it illustrates the diverse individuals that caregivers support. As well, it also reflects the diversity of the caregivers themselves. As we can see here, nearly half of caregivers support their parents or in-laws, so older adults. About a quarter support their extended family. That could be grandchildren caring for the grandparents or siblings caring for one another, etc. Approximately 20% care for their partners. 11% care for children. Those could include children with disabilities, developmental conditions, chronic illnesses, or mental health needs. And then there's also 9% of caregivers who care for non-relative. All right, so what does it mean to be a caregiver? What does the role consist of? It's a very busy one for sure. So caring for loved ones or any care recipient, but we will refer to them in this presentation as loved ones. It actually involves taking on multiple essential responsibilities and wearing many hats. Beyond providing emotional support, caregivers frequently accompany their loved ones to medical appointments, they manage their medication, they organize test results and healthcare documentations. They often serve as interpreters for medical information. In many cases, caregivers also provide hands-on physical assistance with daily tasks such as feeding, dressing, bathing. Um, many care recipients or loved ones do receive some supports from the government, but unfortunately, due to lack of funding, this is nearly ever enough. So the caregivers have to do that. Coordinating care among healthcare providers and community services becomes a routine part of their daily routine of their role, as does advocating for their loved ones' needs, and that can become very challenging. Additionally, many caregivers act as a central point of communication for families and friends, and often they become responsible for making important legal and financial decisions. That can become very difficult, and it carries with it a very heavy weight and responsibility, as many of the caregivers are the substitute decision makers or the power of attorney for the loved ones that they're caring for. Remember that many caregivers don't actually reside with the person that they're caring for. So all of these things that they have to manage require a lot of logistics, a lot of rearranging their schedule. So very busy for sure. So I wanted to share some statistics with you, and they are taken from Spotlight on Caregivers of Ontario Caregivers report from the Ontario Caregiver Organization. But before discussing Ontario numbers, I just wanted to mention that sorry, I just want to point out that according to Statistics Canada, in 2018, approximately 7.8 million Canadians aged 15 and older, so that's approximately 21% of the Canadian population at that time, that's 1 in 4 adults, reported providing care to a family member or a friend with a long-term health condition, physical or mental disability, or problems related to aging. So that's some Canadian numbers back in 2018. But here in Ontario, there are approximately 4 million caregivers. 59% of those are between the ages of 36 and 64. That makes them the sandwich generation. So they simultaneously care for their aging parents while also supporting their own children, many of which still live at home and are financially dependent. 34% of caregivers provide more than 10 hours of care per week. Almost 1 in 5 care for more than one person, and caregivers spend an average of $641 per month on care-related expenses. So of those, 1 out of 3 report that they are feeling the financial toll of this. And while most use their personal finances or savings to cover these costs, 1 in 4 have actually needed to take out a loan or use their line of credit to support their loved ones. So caregivers' duties can really impact their own health and well-being. Research has shown that caregivers are more likely to live with 2 or more long-term health conditions themselves as a result of sometimes ignoring their own medical needs. In our practice, we hear often from caregivers that, they need to put off a surgery that they need or a medical procedure because they worry that no one else will be available to care for their loved ones. A striking 32% feel that they are unable to cope with their caregiving role, and nearly 3/4 report that they are feeling so burnt out that they're not sure of how they can continue. This intense burden also contributes to higher rates of loneliness, stress, and depression among caregivers, and this highlights really the urgent need for better support for them. Many caregivers fear and worry about dealing with their loved ones' declining health, making sure that their loved ones' needs are met, as well as balancing caregiving with other responsibilities. So we mentioned the financial toll, but clearly it doesn't end there, and there's a great toll on health and wellness as well. Okay, and a little bit more, last slide of statistics. So just a little bit on employment. So as we indicated above, approximately 60% of caregivers are the sandwich generation. Of those, approximately 67% are still working and providing for their families. 54% have considered reducing working hours in order to provide better care, while 43% have considered quitting their job altogether. 34% are concerned about job loss, and 6% were actually fired or laid off due to their caregiving responsibilities. And that number is 5% higher from 2023, so it's quite concerning. Overall, caregivers wish that they would receive more support from their employers, and therefore we've seen an increase in awareness and in the importance of providing education to employers, as well as many Ontarians have been impacted in some way by their caregiving role. Okay, so I wanted to move on now to now that we've seen who caregivers are and who they're caring for, we need to discuss some of the universal challenges that they face. Caregivers encounter a range of challenges that affect both their well-being and their ability to provide care as a result of that. So here are some universal challenges that caregivers can experience in their journey. Most of these are interconnected, and so one can very easily impact or cause another. I'll start with emotional strain. So, witnessing a loved one's decline in health or cognitive abilities can be very much emotionally taxing, leading to stress, anxiety, and feeling of helplessness. Lack of emotional counseling services that are available for both the care recipient as well as the caregiver can also result in emotional strain. Financial strain, external supports such as obtaining private care, therapies that are not covered by OHIP, transportation costs, etc., can cause financial hardships. Additionally, there are many costs that are associated with caregiving, medical expenses, home modifications, lost income, as we discussed, and all of that can also create financial hardship. Social isolation. So caregivers may experience social isolation as their time and energy are really focused on their caregiving responsibilities. And this really leads to loneliness and lack of social supports. Yeah, a lot of people feel that they're alone, that they can't really talk to anyone. So they just focus on what they're doing, and for some reason they feel uncomfortable reaching out for some support. There's also lack in professional supports. So many caregivers lack adequate support network and making it difficult for them to navigate and to coordinate care within the healthcare system. In our practice, they often report that they feel unsupported according to their needs. Guilt, when we work with caregivers and when we facilitate caregiver support groups, we often hear about this as experienced by many caregivers, especially when they feel that they are not doing enough or when they need to prioritize their own needs. So that's definitely a big one we hear. And finally, caregiver burnout. Unfortunately, when caregivers encounter several challenges, the constant demands of caregiving can lead to caregiver burnout. And this includes emotional and physical exhaustion, impacting their ability to provide care, as well as their own well-being. At times, unfortunately, caregiver burnout can result in unintentional harm and sometimes even elder abuse towards their care recipient. So here are some warning signs for us to watch for. Many caregivers don't always openly admit that they're struggling. This could be due to guilt, pride, or simply because they're just too overwhelmed. However, certain statements can be or can act as red flags. So they signal some hidden stress or burnout, even when it's not directly expressed. We really need to listen carefully. So phrases like, I'm always tired, I haven't left the house in days, I feel like I'm failing. These are all opportunities for us as healthcare professionals to gently check in, listen, and offer support. So it is really important to emphasize that every caregiver is unique in their experience. All caregivers have, a lot of similarities in what they experience, but also very, very individualized experience. So, caregivers, like I said, they navigate a wide range of emotions through their caregiving journey. Some may report feelings of joy and a deep sense of connection with their loved ones, but at the same time, they may also experience many difficult feelings, such as guilt, anxiety, shame, anger, and even resentment. We hear that often. Other caregivers may find a very strong sense of purpose or meaning in the role, and they express that despite the challenges, they would not change a thing in their experience. Caregiving is deeply personal. It's influenced by the unique dynamics within each family. An individual's comfort level in providing care often reflects on the nature of their relationship with their loved ones. And additionally, cultural beliefs can significantly shape caregiving experiences that could influence expectations, responsibilities, and emotional responses. So now I will pass it on to Maria.
Thank you, Eleanor. So let's continue. So now that we discussed, who are caregivers, what they do, and what are the universal challenges that they experience, now we're gonna take a look at the concept of caregiver resilience, right? And also explore the role of as healthcare professionals, our role, how we can play in supporting and strengthening this resilience. So, what is caregiver resilience? Caregiver resilience refers to the ability of caregivers to adapt, cope, and maintain their well being despite the emotional, physical, and financial challenges of providing care. Caregivers, whether they're supporting their parents, older adults, or their loved ones with disabilities, or those with chronic illnesses, often experience high levels of stress, frustration, and anger. Resilience is what allows care partners or caregivers to continue their role without compromising their own health. So, resilience is not something we're born with, right? It's not something that we went to school for, right? But it's a skill that we develop over time. As our circumstances, responsibilities, and maturity evolve, so does our capacity for resilience. So, like caregiving, the process of building resilience, it's personal. Shape our own individual circumstances and behaviors and thoughts and actions. So, why caregiver resilience matters? Why is it important? It's important because it helps individuals sustain their caregiver role, again, without compromising their own mental, emotional, or physical health. Resilient caregivers are better able to manage their own stress, prevent burnout, and maintain healthy relationships, and provide consistent quality or high quality over the long term. Without resilience, caregivers are at a greater risk of fatigue, depression, and even their old illness, negatively impacting both themselves and those they care for. But let's be clear and transparent here. Being and building resilience, it's not easy, right? This process is very complex, dynamic, and it takes a lot of effort and energy for caregivers. And we all react differently to stress. And the strategies that work for one person might not work for the other person, right? So being resilient doesn't mean that we want to avoid stress or we'll avoid the stress, but it means learning the tools so that we can better adapt and recover from it. So now we're going to move on the professional's role in fostering this resilience that we just mentioned. So here we have an illustration that shows, again, how professionals promote caregiver resilience. And when I'm talking about professionals, I'm talking about all those professionals involved in the clients or the patient's care, right? Such as a doctor, nurses, social workers, occupational therapists, care coordinators, and so on, right? So there are three main components that we need to keep in mind in our own practice that will foster this resilience. And these are communication, collaboration, and empowerment. So working in collaboration with other healthcare professionals and the families of the patient is essential. When professionals in healthcare work with caregivers, we must again recognize the caregiver is complex and multifaceted. So it requires a team-oriented approach. So we need to stop working in silos. As professionals, we all come from different professional backgrounds and can offer our expertise and knowledge to caregivers in different ways. But without the effective collaboration, care can become fragmented and caregivers may feel overwhelmed or confused by the conflicting advice that they receive, right? So collaboration ensures that there's consistency in the recommendations and in the care plans, and it makes it easier for caregivers to navigate through all of it, right? And follow through accordingly. So again, regular communication between the professionals and the families ensures that we're all on the same page, right? So this includes setting expectations from the beginning, from the get-go, discussing what are the goals and addressing the concerns accordingly. It fosters a sense of trust and partnership, which can lead to more positive relationships and a stronger support system, again, for both the patient and the caregiver. So it is important to emphasize that we need to offer our supports and empower caregivers at the beginning of the journey. And we have seen this through our practice that this makes a huge difference, right? In order to avoid the challenges that we discussed earlier, and including burnout, right? So working with caregivers at the beginning of the journey makes a big change. But now, so how do we empower caregivers, right? So here you can see some key areas where professionals can positively impact that caregiver journey. This include education, social support, self-care, and advocacy. So there's the four pillars there, the four. So all this can result in caregiver resilience and better care for the patient or the care recipient. Okay, so now we're going to discuss a little bit more about each. So the first one, it's education and skills training. So when we talk about this, we talk about educating caregivers, right? About, for example, about the care recipient's condition and expected challenges, because this can boost their preparedness and confidence. So for example, caregivers learning about diabetes or stroke or dementia can help them gain that knowledge and being more prepared, right? So by referring them to community agencies where they can attend workshops or webinars can be very beneficial. Another way in providing training can be training in key caregiving tasks, like administering medication that can be challenging for some people, or managing behaviors. It can also help reduce the stress and build the competence. For example, connecting caregivers to the LOFT program. There's a program that assists caregivers in managing responsive behaviors in their loved ones, right? It's a good way of them learning those skills. Overall, connecting the caregivers with different local supports, right? Practical, emotional, and financial supports, right? Can lighten their caregiving load, right? So referring them again to interior health at home, for example, to receive different community services, adult day programs, respite care, and so on. Also, encouraging the use of technological tools, right? Nowadays, a lot of people are using technology, but now how can we use technology to our advantage here in the caregiver role, right? So for example, medication reminders, appointment scheduling, and a good example that I always say, it's the false pendant. The false pendant is a good example. The false pendant is for the actual patient, right? But it can also provide a peace of mind for the caregiver in the event that there is a fall and, for example, their loved one lives alone. The fall will be detected and help will be on the way, right? And there are other examples that nowadays technology, it's a huge help for the patients and the caregivers as well, right? Now, the second key area is social support. So support groups. Nowadays, we have in-person and lots of virtual support groups. So that's a good thing that came after COVID, I guess, the virtual support groups. So yeah, connecting caregivers with support groups, because by them connecting with other caregivers that who understand the challenges of caregiving, they can provide with each other that emotional support, reduce isolation, and offer practical advice, right? Um, and again, in the virtual world right now, there's lots of caregiver support groups. Someone can be in Toronto, but attend a support group in another part of the province, for example, right? Because of different schedules, some programs are in the morning, some are in the afternoon, some are in the evening. So now there's a wide variety of selection that caregivers can choose based on their availability. Also encouraging caregivers to seek support from their social network. So who do they already have that they haven't seek support yet, right? Such as family members, friends, or neighbors, which can also help share the burden and reduce the feelings of isolation, right? Sometimes, caregivers think they have to do everything themselves, and they don't stop and think, who else do they have in their network, right? So as professionals is asking those questions, right? Who do you have? Like, sit down and who do you have with you? So they can start thinking who else can be part of the care, right? So now the third key area is self-care and well-being. So we need to remind our caregivers, and we say it all the time, for our caregivers, they need to put their oxygen mask first, right? The metaphor that we use, pretend that we're on a plane, right? The caregivers need to put their oxygen mask first. So reminding caregivers to prioritize their own health, right? Their own well-being, by encouraging self-care, right? Either by getting enough sleep or eating a healthy diet, setting healthy boundaries, which is very important in the caregiver role, engaging in regular physical activity, or anything that brings them joy and helps them to recharge, right? They shouldn't feel selfish by doing all these things for themselves, but it's actually like a social prescription. This is what they need to do to help themselves, right? Even in the small little ways, right? Also teaching them about emotional regulation, right? Like we said before, different things are available out there and different things work for different people, right? So try to explore what's available for them and what works for them, right? Such as caregiver stress management techniques, relaxation exercises, mindfulness, yoga, whatever helps them cope with the emotional challenges of caregiving. Also encouraging caregivers to seek professional help when they need to, right? And again, like we said, it's better to seek help or encourage getting help at the beginning of your journey rather than we're already there at the burnout stage, right? So they can get support one-on-one and counseling and therapy, or again, attend a support group, especially if they're struggling with depression or anxiety or other mental health issue. At last, we need to acknowledge their efforts and validate their experiences, to foster, again, a sense of competence and reduce their feelings of isolation. And the last key, the key area, it's about advocacy, right? So as we know, as we discussed throughout, caregivers often manage complex responsibilities, right? From just booking a doctor's appointment to figuring out what's going to happen to their loved ones when they go on vacation, for example, right? So there's a lot of logistics, like Eleanor said before, right? But our role is to ensure that caregivers are not operating in isolation, right? So advocacy efforts should focus on making resources, that we have mentioned before, more visible, accessible, and tailored to the caregiver's diverse needs, right? Champion caregiver voices. Therefore, like by empowering them through like including them in the decision-making process and the patient care planning, right? Nowadays, we see that caregivers are now more involved, for example, in hospital discharges, like compared to years ago, right? So continuing that, it's great, right? And as mentioned before, like caregivers, especially those who work, struggle to balance the work and their caregiver duties. So advocating for employment policies that can accommodate caregiving responsibilities is important. So for us as professionals, and depending on which agency, which type of population that we're working with, it's important for us to participate in ad hoc committees or working groups that support and acknowledge the importance of the role of caregivers within our community, right? So we are the voices of caregivers in this healthcare system, right? That still doesn't fully recognize or support them, right? We have come a long way. Yeah, for sure. We have come a long way in acknowledging their role, but it's still not enough. So it's still a work in progress, right? So that's why, again, we must continue this work to advocate for change, promote the caregivers' well-being, and honor their invaluable contributions to society, right? So again, those are the four key areas that for us professionals in any area in the healthcare field that we work with, that we can make an impact in the caregiver journey, right? So again, education, social support, self-care, and advocacy. So let's keep those in mind. And just to wrap up, again, a big thing that we want to emphasize here, and if you want to take just one thing out of this whole presentation, we want to really emphasize the part that we need to talk about caregiving as a societal issue, right? Because like it or not, most likely this will in time touch the lives of all of us, right? At one point or another. So here are our final thoughts. Supporting caregivers is essential, right? Because they're a critical part of the patient care team. So we all need to be connected, right? And as for professionals, we need to, by empowering caregivers with the tools to build this resilience, we can reduce burnout. And again, regular communication and collaboration promotes more sustainable, compassionate care for both the patients and the caregivers, right? So those are our final thoughts, and that's the overall content of our presentation. And now we're going to move on to some resources. And again, this is just some general resources. And the first one, of course, Circle of Care, because that's where we work, right? So at Circle of Care, we have a variety of supports, of programs, services. One of them is the social work support, where we have social workers that provide caregiver support, even for one-on-one support over the phone, or we can also do home visits for caregiver counseling. We have several social workers that we speak different languages, right? So for those caregivers who would like to have that connection, right? We have like Eleanor speaks Hebrew, I speak Spanish. We have another social worker who speaks Russian. And yeah, so we have that capacity. We also have the adult day program, our somewhat new adult day program, which is a great new facility, very bright and clean, I will say, right? The adult day program. So the adult day program, it's more on, it's open 7 days a week, right? And we have programs for clients with dementia and for those older adults who are frail. And it's located more on the north side of the city by Bathurst and Rutherford, I guess, in between Rutherford and Mackenzie on Bathurst. We also have for home care services where, and this is a paid service by getting PSW service that can provide respite hours for the caregiver. And that's what sometimes we say, right? Because we tell our caregivers, you cannot do it all, right? You need some time for yourself. And so by getting some PSW hours, then the caregiver can do their own things on their own, right? We also have transportation services, iRide, and again, lots of services. So yeah, if you want to find out more, please connect with Circle of Care. We also put here the Ontario Caregiver Organization. So that's a wider and great resource, and they have their own resource library with lots of resources. They also offer peer support groups, and they host lots of webinars that are very informative. And again, providing the education to the caregivers, as we discussed, is very important for their journey, right? We also have here the Bakercy Card Assessment, which is a tool, an assessment tool that's based, so they collect their answers, and based on that answers from the questionnaire, they will provide a list of recommended resources that they can follow through. We also have the Canadian Center for Caregiving Excellence, again, with lots of resources. The Cares Canada, that's more a federal, I guess, initiative, right? That leads more advocacy initiatives and awareness campaigns that a lot of community agencies are being part of, right? So if any of your agencies are would like to explore that, that will be a good start. Again, Geriatrics Ontario also, they provide some more caregiver strategies. And 211, that's if you want to refer a client or caregiver for community resources throughout the GTA. Because as you know, most agencies work based on a catchment area. So depending on where your client or caregiver lives, they can be referred accordingly. And yeah, and that's it. Thank you so much for staying with us. And yeah, and these are our contact information. Eleanor and my email address, our email address there. So if you have any questions, I guess we still have some time, so you can ask if you have any questions, and or email us later if you like.
Thank you both so much. Thank you. There are no questions in the Q&A. Someone wrote thank you. I wanted to know, I see we have representatives from Giants, we have Jack, I think we have KCC. I'd love to know either from you or maybe some of the attendees. I'm thinking of, you guys focus on caregiving is a task that lots of people end up taking on, many of us. And I'm wondering about people like young children caregivers. So children of new immigrants, who are end up being the translator for their parents, or siblings of children with disabilities or chronic illness, or even just, yeah. And I'd love to know if there are either resources or what the supports might exist, or how clinicians can address those or support the family so that the child can get that some type of support and yeah.
Yes, thank you. And actually, funny enough, I think last week, a couple of weeks ago, I attended one presentation when I learned about this resources, this program that helps young caregivers, like you mentioned, but they were based on the state. We had the presentation here in Toronto, but the organization itself, it's based on the state, but I think they support young caregivers around the world. So yeah, I can share the resource after, because yeah, that's another group that I guess sometimes gets missed, right? And I know the Ontario Caregiver Organization also, they have some workshops, and they have a specific program for young carers, they call it, or young care partners, right? Yeah, so that's available in the Ontario Caregiver Organization.
Thank you. That's very helpful. Eleanor, were you going to say something?
No, I just wanted to, I mean, we work at Circle of Care with older adults. So although we do work with caregivers who care for someone over 55 and over, so they could be younger. But we haven't had any experience working with super young. I would also strongly recommend the OCO, and anybody can contact them, and they will actually have a library of resources for all caregivers. um, I'm actually part of a working group, a caregivers working group, and we're working on with the OCO and kind of compiling and putting out there a number where anyone can call to get resources for their specific caregiving needs.
Right.
And I wanted to also, given that we're going to end in just a minute, but just given that we are in a meeting as opposed to a webinar and anybody can sort of post in the chat, I was wondering if anybody here who works at a different agency has some type of caregiver support specifically at their agency. If anybody might be able to, if you do have something, would you mind writing, blank has a support, or again, if no one has anything, that's also fine. Just wondering, because then you can know, as clients come into your space, that you can maybe know where other resources might lie within the network of our social services here in Toronto and Jewish community. Or not. Either way is fine.
I would also recommend Jewish Family and Child, I think, as they work with a lot of younger people and children and youth and, younger caregivers.
Yeah, wonderful. Well, I want to thank you both so much for your time and this amazing presentation. It was very informative. The recording will be sent out in a follow-up email, as will the slide deck, so everybody can take home these resources. And I would really appreciate if those who attended can fill out the survey so that we can know about continuing these series, in the years to come, or at least to next year. So I'd really appreciate that. And again, thank you so much, everyone. Have a wonderful day. Thank you, Eleanor and Maria.
Thank you. Thank you for having us.
Thank you so much.